टू जी मनी हेल्थ शो। मैं हूं नेहा बजाज और अपने हर शो में हम आपको मिलवाते हैं मेडिकल एक्सपर्ट्स और सुपर स्पेशलिस्ट से ताकि आपको मिले सही राय। एंड टुडे आवर गेस्ट इज डॉक्टर देव कुमार, हु इज अ मेडिकल ट्राइकोलॉजिस्ट एंड कॉस्मेटोलॉजिस्ट। डायरेक्टर हैं वोला क्लिनिक काडालोर, तमिलनाडु में काफी सालों से प्रैक्टिस कर रहे हैं। सो लेट्स इंट्रोड्यूस डॉक्टर देव कुमार। हेलो डॉक्टर, वी वेलकम you to our show.
Yeah, hello.
And Dr. Dev, today we are going to talk about hair fall and baldness, because hair plays a very major role in shaping our personality. In fact, a person's age somehow is determined by the amount of hair that he or she has on their respective head. So my first question to you is about alopecia areata. जैसे different types की baldness होती हैं, baldness को we call alopecia. So please tell all the viewers, what is alopecia areata?
Alopecia areata is the medical condition in which the hair is getting affected much. The thing is, alopecia means hair loss, areata means the patchy, which means the patchy hair loss will be there, which is a round in shape. Initially, it will start anywhere in the head in the round pattern, like small coin size pattern. And from there, based on their medical problem, it will extend to the unlimited area. So full head also may get affected in that area. Okay,
and so where is alopecia areata seen? Like here or sides, crown, temple area, which area?
No, it is a autoimmune disorder, which means our own immunity attacks our own cells, hair cells, which means wherever the immunity is high in progress, the immunity is very high in active, that area will get affected. It is not any specific area. Any area may get affected, either head or eyebrows or even body hair, beard, anywhere it may come.
Oh, so this can also affect beard or body hair?
Yeah, it's based on that only we will segregate as a different types of alopecia areata. If it comes in beard, we used to say it's alopecia barbae. If it comes in whole head, we used to say alopecia totalis. If it comes in whole body, we used to say alopecia universalis. That means only the body hair will lose.
So, patchy baldness, as you said, alopecia areata. So जिनको भी scalp पे अगर ये दिक्कत हो रही है तो कौन से जगह के बाल जाने लगते हैं?
Actually, alopecia areata is not a baldness. Baldness is entirely different condition from alopecia areata. The baldness means you will get a hair thinning as well as hair loss in particular area, especially the front area, the backside area. So that is a baldness pattern. But alopecia areata is an immunity disorder, autoimmune disorder. Once your immunity is affected or immunity is very high in progress due to some kind of stress factor or some kind of disease factor, that time only you will get a patchy hair loss. That is called alopecia areata. Baldness is due to your genetical, based on your parents might be bald or your.
So that's what I'm asking, that if anybody has this autoimmune disorder and by chance the scalp hair starts to shed, then which area starts shedding? Like the sides, front, or the back?
No. Alopecia areata doesn't have any pattern. It may start from anywhere. Either it may start from front or it may start from backside or sideways. Anywhere it may start. But it extends to whole head if it is not treated properly.
So you mean that there is just hair thinning or the roots start to shed?
Actually, first what will happen is it will not go to thinning. It will shed in the full face itself. Once the immunity is affected, it will shed immediately without thinning. In baldness only, the thinning progression will be there.
Also, sir, we want to know that are women more prone to this or men more prone to this, and from which age we see the cases of alopecia areata?
Yes, in alopecia areata, in India, actually it differs from countries to countries. In India, mostly the male will get more affected than female. And people whoever is having that disturbed sleep or irregular in diet, or people who is very emotionally stressed, especially the people working in IT sector, they are more prone to get this kind of alopecia areata because their lifestyle is getting affected. Because of that, so they are predominantly more possibilities of getting the alopecia areata. And age group is less than 40 is more affected than the aged people.
Okay. And so besides this autoimmunity thing, are there any other factors as well, like heredity?
Yes, but still it's in study, it's in research purpose or research area only. But the genetic people, if father or mother is having such things, and they are getting more chance, and their children is getting more chance to get this alopecia areata. But it is not 100%, but some more chances only.
Okay. Also, sir, what are the initial signs or the red flags that anybody can look for that this is the starting of alopecia areata and now it's time to see a doctor?
The first sign is they will get a round patchy hair loss. In particular area, there will be a round patches, and that area there will not be any hair. That is the first sign. Initially, it will be like a 50 paise coin size. So in that time itself, we have to check with the doctor. Otherwise, it may extend to very bigger size.
Also, sir, is alopecia areata treatable? And and can we reverse the hair loss process?
Yes, definitely. But it is more possible in initial stage, because the autoimmune, first of all, we have to find out the real cause factor of the immunity disturbance. Either it may be emotional, or it may be a lifestyle problem, or a diet or food pattern. So we have to find out as early as possible. In that, we can able to reverse it fully. If it is a very chronic state, that means more than 3 months or some kind of thing, then it may take some time, maybe 6 months or 1 year.
What is an effective solution to alopecia areata? As in, you give some serums, are there any antibiotics, and a patient has to take the medicine for lifelong, or is it just for a limited period of time?
See, as I said earlier, it's mainly due to your immunity oriented. So first of all, you have to check with the whole body what is the problem, the disease associated with this. So if they're having any problem or any disease, we have to cure that one. Otherwise, we have to go with the lifestyle corrections. We have to go like they have to take food on right time. They have to sleep 8 hours night time. They have to do a physical activity which reduces the stress level. So all those things that we have to find. Other than in a medical part, what we used to do actually, our physicians, what we recommend is topical minoxidil they will recommend, and topical and oral steroids they will give to suppress the immune thing. So after that only we can expect a new growth of wherever we lost a hair.
Okay. And sir, technically, because these days everybody is very stressed, the work hours are quite hectic, and definitely we eat a lot of junk food. The food is not pure. So do you believe that these days everybody is at risk of alopecia areata?
Not everybody we can say, because as you said, most of the 90% of the people are getting into this stressful life nowadays. So the people, at least some factors that we have to follow, at least the sleep actually, the 8 hours sleep and stress factor, and alcohol, and wherever we can able to follow the right way of living. So we can able to reduce the thing, but not 100% of the people with emotional lifestyle will not get this alopecia areata.
Okay. Also, sir, my last question to you is, what are the preventive measures? Since it's an autoimmune disorder, how can we boost our immunity, or what can be done that we do not suffer from alopecia areata?
Not only alopecia areata, I will give general tips for overall hair loss itself. First thing, my first thing is sleep. Actually, 8 hours sleep is must, that too night. Because a lot of factors are there in that. So day sleep, comparatively, day sleep is not that good for hair. Night sleep is very, very essential. And second is, fruits and vegetables is must in your food, daily food. 1 bowl of fruit, 1 bowl of vegetable is must. So that will maintain your metabolism, which suppress or which retains your immunity in order. So, and third one is a lot of water intake. Nowadays, people are not taking water because they do not have a proper physical activity. So they don't have enough water intake. So that also the major problem for this kind of immunity oriented thing. And the last one is junk foods. Mostly we should try to avoid the packed food already is coming, especially which is more carbohydrate and more sweet related foods that we have to avoid, because directly related to your hair actually.
So thank you so much, Dr. Dev Kumar, for all your useful tips on alopecia areata, and thank you so much for taking out time for our show.
Thank you very much for your wonderful interview, and I'm glad that I given my tips as well as possible.
यस तो ये थे डॉक्टर देव कुमार जिन्होंने ज्वाइन किया हमें तमिलनाडु कडलोर से और इतने अच्छे अच्छे टिप्स हमें बताए। एंड यस एलोपेशिया एरियाटा, जैसे कि हमारे शो में हम आपको यही बताते हैं कि बहुत सारी ऐसी चीजें हैं जिनको हम सिर्फ ऊपर ऊपर से जानते हैं, हमें उनकी इंटरनल नॉलेज नहीं है, अंदरूनी जानकारी नहीं है। सो यस आई एम श्योर आज का वीडियो आपको पसंद आया होगा, ये टिप्स आप जरूर फॉलो करेगा बिकॉज मैं तो फॉलो करने ही वाली हूँ। अगले वीडियो में हम मिलेंगे एक नए सुपर स्पेशलिस्ट मेडिकल एक्सपर्ट से। टिल देन आप अपनी सेहत का ख्याल रखिए, स्वस्थ रहिए, मस्त रहिए और देखते रहिए जी मनी हेल्थ शो। अच्छी सेहत हमारा वादा।